can I lower my LDL naturally? That's the LDL cholesterol she's referring to. So I can get off Lipitor. She's on Lipitor. And I'm a type 2 diabetic, controlling it with diet. I feel the need to get off this medication. I'm starting to feel the effects of it. Lipitor can cause fatigue, and it raises blood glucose, making diabetes worse, and it promotes weight gain. So it's good to get off Lipitor. I object to the word controlling your diabetes. I'm a type 2 diabetic controlling it because I'm saying you should get rid of it, not you should get rid of your type 2 diabetes, which means so the question is, are you thin and fit and healthy enough? If you're a woman, then the question is, what's your height and weight? If you're 5'5" with diabetes, 5'4", 5'5", your weight should probably be under 115 pounds because we want to get that fat out of the body so you're not diabetic anymore. That's the most important thing. The Lipitor is not as important whether you're taking it or not taking it, as is getting your body fat down and being super fit. Because when the muscle cells are surrounded with fat, it makes them glucose intolerant. So I'm saying, don't control your diabetes, become non-diabetic. And this program should enable you to become non-diabetic. So the question is, have you reached your ideal weight? And if you haven't, what's the rate of weight loss you're keeping up as you approach that ideal weight? Those are the main questions. If you keep up the weight loss and you keep getting there, then you'll be able to get off the Lipitor, because your LDL will lower sufficiently as the saturated fat on your body gets low enough. The Nutritarian diet that I'm recommending, which is a longevity life-extending program, that I'm picking the most ideal foods for the human species, it doesn't guarantee you health and weight loss. It makes it comfortable to eat the right amount of calories because your body is flooded with nutrients and fiber. So you don't need to overeat to feel okay. Diets of all description that flood the media and the internet don't work because people can't reduce their calories because their cravings are too overwhelming eating that way. The point I'm making, this does not guarantee you're going to lose weight. It makes it possible for you to lose weight. When other ways were impossible, this makes it possible. But you still have to do the work. Mm-hmm. You still have to figure out how to make this work. And that means you tweak the diet so it has more green vegetables, more onions, mushrooms, more lower caloric density foods, removing maybe some beans and nuts. Make sure you don't have oil, of course, or flour. But you've got to tweak this diet so you're still not eating thimble-sized portions of food, yet at the same time enabled to keep your calories low enough to assure a 2-pound weight loss for a 57-year-old who's not physically active. When you're losing weight, your inflammation in your body goes down when you're overweight. And as you keep losing, the inflammation stays down. But the minute you start gaining again, even if you're a lower body weight, the inflammation starts to go up again. If you're overweight, you can't be stable because then you are going to have a lot of inflammation. You have to keep losing weight in the direction of your ideal weight. This takes a tremendous amount of dedication. You've taken the initiative to get here, and now you've got to make sure you do this so you get results. Results means you're doing it right. If you're not getting results, we've got to figure out what you're doing wrong.